A very good morning to all dignitaries, guests, and delegates. With great joy and immense exultation, I request all of you to please be seated. I, Dr. Priya Malvatkar, Associate Professor, Prasuti-Tantra Serog Department, feel privileged to extend my warm welcome to all presented here for Ayush Sannai 2023 National Conference on Recent Advances in Research in Ayurveda. On behalf of Ayurveda Prasarak Mandal's Ayurveda Mahavidyalaya, I welcome you all once again. Thank you. Friends, Acharya Charak has mentioned Sandhai Sambhasha, that is friendly and healthy discussion on the topics intended for updating your knowledge and acquiring expertise. And with these aims and objectives, we are our college head and the organizing secretary of this event, who has clubbed all of us together. I am delighted to announce that today's inaugural function we have respected Dr. Raman Gungalekar sir, Directorate of Ayush Maharashtra State, and Dr. Narayan Jadhav sir, Member, Board of Ethics and Registration, NCISM, Ministry of Ayush, New Delhi. Our patrons and chief guests will join us at inaugural session. Ladies and gentlemen, let's start the treat of knowledge. The opening batsman for this treat is our own beloved, respected Dr. Anaya Kathikar Madam, a hardcore academician, Professor, HOD Kai Chikitsa Department, Ayurveda College, Sion. I will take the honor to introduce Madam. Dr. Ania Madam has genius academic record. She has taught all university exams, UG and PG. Madam is awarded PhD for her best thesis on mind relaxation therapy in stress-induced diseases. She has also completed PG diploma in clinical research and pharmacovigilance. Dr. Ania Madam is an author of 3 books. She is working as PG guide, PhD guide, co-investigator for various clinical trials. Ma'am has published more than 40 research articles in various national and international journals. She has presented many research papers. Madam has delivered keynote addresses, guest lectures on various platforms. She has imparted her knowledge as expert on All India Radio in Arogya Sampada. Madam has awarded as Best Teacher Award by Khadiwale Sanshothan Sanstha. Friends, please get ready to hear the stalwart with great vision to nourish research culture among students by micro-teaching and adopting advanced teaching modules without compromising basic principles. Ladies and gentlemen, please welcome Dr. Anaya Patrikar Madam with big round of applause. Madam, please occupy the dais. For this session, I am delighted to welcome Dr. Santosh Giribide, Chairperson, I would like to
Good morning, everyone. Welcome all the delegates and respected chairperson and co-chairperson. For today's session, Dr. Santosh Govindrao Giribide sir is the chairperson of today's first session. He has been completed his BMS in 1997 from GAC Nanded, Dr. Babasaheb Ambedkar Marathwada University. Also, he has completed his MD in 2002 in the subject Rog Nidan and Vikruti Vigyan from Government Ayurveda College, Nanded, under Swami Ramanand Tirth Marathwada University, Nanded. Sir has been a professor and HOD of Department of Rog Nidan and Vikruti Vigyan, R.A. Poddar Ayurveda Medical College, Worli, Mumbai. He has a clinical experience of 22 years, undergraduate teaching experience of 19 years, postgraduate teaching experience of 15 years, and a PhD teacher since 5 years. Sir has a special duty since 2019. He has been working as exam coordinator and OSD at State CET Cell 4, Mumbai for UG and PG admissions of medical, Ayush and allied courses. We welcome you, sir. Our next co-chairperson, Dr. Santosh Govind Dahlekar, sir. Sorry, sir. Dr. Sandeep Govind Dahlekar, sir. He has been BMS from Chaitanya Ayurveda Mahavidyalaya, Sakegaon, Bhusawal. He has also done MD in Rog Nidan and Vikruti Vigyan subject from Tilak Ayurveda Mahavidyalaya, Pune University, Pune. He is currently pursuing a PhD under the title Inflammatory Markers as a screening test in COPD with Nadi Kathindya from Parul University of Ayurveda, Vadodara. Sir has been a reader in Chaitanya Ayurveda Mahavidyalaya, Sakegaon, Bhusawal in the year, from the year 2012 to 2019. Next, he was the professor in Parul University, HSPM Ayurveda Medical College, Kolhapur, for 1 year, 2011 and 12. Then he was again leader in Chaitanya Ayurveda Mahavidyalaya, Bhusawal, from 2012 to 2019, and currently a professor in Parul University of Ayurveda, Vadodara. Sir has been also a part of a seniority prologue on Dr. Subhash Baghi's textbook of Rog Nidan and Vikruti Vigyan, first paper as per CCIM syllabus, though being his fourth batch junior. Second book is Tum, The Mirror of Tummy. Third is Jiva Sachitra Vivaran in Diagnosis of Vata Vidya. And lastly, Secrets of Tongue in COVID-19 and TB. A very warm welcome to you too, sir. Please give a round of applause first.
Thank you, audience. Thank you, Priyanka. Thank you, audience. Now, may I request Dr. Anaya Patrikar, madam, to share her views on the topic Introduction to Research Methodology and Ayurvedic Perspective. Ma'am, please.
Good morning, everyone. On behalf of our for the seminar, I welcome Dr. Asmita Velle, madam, also. Sir and principal sir is accompanying. I should accept it as the prima facie only, that I am not an expert person in research. So I try to share my views. So whatever corrections principal sir will give their opinion, so it will be beneficial for all of us. Has mentioned it correctly about the research from Ayurvedic point, and he has mentioned that it's the study of cause and effect relationship between dravya, guna, karma after several observations. This is what is mentioned as anusandhan. In our research, all of us know about the definition of research. It is search for knowledge or as any systemic investigation to either establish thinking about the research. What? Just a minute. Huh? Sorry for the technical glitch. Research should be a process that converts data into information, information into knowledge, and knowledge into wisdom. So this is like transforming milk into ghee. Research should be more balanced, comprehensive, and equally emphasizing in the literary field, experiential and experimental as well as clinical research. It should be able to impact the fields of academics, pharmacy, and practice in profound way. There are some of the objectives of the research. We will not go in details because I would like to elaborate Ayurvedic perspective more and more. Why research is needed? Because that provides the basis for rational practice, and whatever unnecessary things or harmful things are there, those can be nullified once we do the extensive research. What are the requirements of research? Two important things are required while starting the research. First thing is that one should be curious. Unless and until person has that jigisha, then only true research or authentic research can be carried out. And second thing is courage. Why courage is essential to carry out the research for longer duration? Because research is not something which will immediately give you the results. Research process can take a longer, as well as one need to be really courageous to accept that whatever research was carried out, probably the society. Second thing, it can be this way that whatever research question was there and we haven't got the expected or the expected results. What are the types of research? There are various types of research, general categories, quantitative and qualitative research. Nature of the study will let us know about descriptive and data type, primary research and secondary research. These are various types of research which are pure research. Then it is generally for conceptual clarification. When it is applied research, it is basically meant towards the solutions for practical problems. Applied research is problem oriented and it is action directed as well. Exploratory and for and it does not aim at testing, but it provides definitors with adequate interpretation, and it's the simplest type of research. Experimental research analytical or statistical research. This particular method or this study is for relationship from various angles. Historical study we generally will not be requiring. Field studies and surveys are important for specifically non-clinical as well as paraclinical side. Diagnostic study is for discovering what is happening and why is it happening and what can be done about the particular process. Evaluation studies are for assessing the effectiveness of social or economical programs. Here we will have to deal with the health issues. Action research and survey research. Survey research, all of us are very well aware. Survey can be anything from a short paper and pencil feedback form to an intensive one-to-one in-depth interview. Survey types are mentioned here. Interview types are also mentioned. I'll share this particular presentation with all the delegates on their mail, so that whatever things I am not going into detail, one can go through it whenever you people are free. Measurements in research and research design. Research methodology. In research methodology, research design is very much important. What is research design? It's an arrangement of conditions for collecting the data, analysis of data in a manner that aims to combine the relevance to the research purpose with economy in procedure. Or research design can be termed as master plan specifying methods and procedures for collecting and analyzing the needed information. So in research design, first of all, we will postulate a hypothesis, then we will define aims and objectives, then we will be defining the methodology. Once methodology is done, study will be carried out, and after the methodology designing and after study is carried out, data collection, analysis of the data, and conclusion and inferences will be drawn. These are the steps in research methodology. First step is identification of the research problem which we want to carry out for the particular research. Once we identify the problem, we have to go through the literature review regarding the particular research problem. Then after going through the literature thoroughly, there will be a step or stage wherein we will be creating the hypothesis, and we will be after postulation of hypothesis, we will be setting aim and objectives. Then there will be selection of study design. Once study design is selected, then sample designing and sample size calculation as well as inclusion and exclusion criteria and other fundamental points in the study design will be done. Then data will be accumulated at the during the process of research methodology or during particular study. Once data is collected, then it will be analyzed and then conclusion will be drawn in such a way that will be helpful to address the research problem which we have initially postulated. For example, suppose someone is carrying out a research project काय चिकित्सा and स्थित चित्तत्व, that is psychological disturbance in a patient. Components of research design, title of the investigation, purpose of the study, review of related literature, statement of problem, scope of investigation. Types of research design. I know that as this is a theoretical part, it will be little boring. But once we start with the Ayurvedic things, probably I will be able to entertain and enlighten you people. Defining hypothesis is the primary. After defining the research problem, defining the hypothesis is the primary requirement, and hypothesis would be a tentative statement about a population parameter that might be true or wrong. So once literature study is complete, then only one should postulate the hypothesis. When the researcher is totally aware of the theoretical and empirical background to the problem, then only hypothesis should be postulated. What is the purpose and function of the hypothesis? Hypothesis should be explanation of the relationship between variables, as well as it should furnish the proof that researcher has sufficient background knowledge to enable him or her and make suggestions in order to extend the existing knowledge. Difference between a hypothesis and problem. Types of hypothesis. There are descriptive hypothesis, causal hypothesis, working hypothesis, null hypothesis, which all PG students are well aware of. So various types of hypotheses are there. After hypothesis is postulated, study should be designed, and after designing the study, sampling is required. Now this sampling also will require different sampling techniques. All these particular study designing will be taken in next hands-on training program. So I'm just enlisting so that you people will remember, especially students will remember the terms, and then once madam start hands-on training, you people can understand it. Types of sampling methods. There are probability and non-probability. All of us know, are well aware with the simple random sampling, then systemic random sampling, stratified random sampling. You people know it very well. Simple random sampling is random sampling. There will be specific number and through which the repeated sampling will be done. And in stratified random sampling, different strata pertaining to various criteria will be made, and then random sampling will be done. So these are the details. I will definitely not go in details of this particular thing. करतो तेव्हा प्रोसिजर्स किंवा वमनासारख्या प्रोसिजर्स बद्दल. So rather than going into these details, definitely I would like to focus on Ayurvedic perspective. Research methodology. What is research methodology? It's a methodology is a standardized, carefully considered way of acting to achieve specific result with assistance. 5 key elements are there. जेव्हा आपण research paper लिहितोय त्यावेळेला research methodology मध्ये 2 गोष्टी महत्त्वाच्या. Systematic procedure for carrying out an activity is required. Research methodology will cover these points, that is formulating research question, then sampling, then research design, then patient examination or field surveys, data analysis, and writing the research paper. Measurements in research, it is related with that data, and steps in research. The way I just explained, these points only will be taken by madam in next presentation, that is hands-on training. Identification and selection of research problem. Then review of literature. Literature can be anything, right from our text, Darshana Shastra till research paper also. And operationalization of concepts, preparation of the research plan, construction of tools of data collection. What are the tools of data collection? We will see how to develop a tool in the Ayurvedic perspective. Collection of data, processing of data, analysis of data, and report writing. Now, once this particular thing is completed, then research designing and methodology is explained in 3 parts. That is planning the research, then operational methods, and reporting. So research it has 3 steps: planning, operation, and reporting. In planning process, selection of problem, formulation of selected problem, then hypothesis, conceptualization, and research plan or design is important. Let me just go through these slides. This particular thing is important according to me. Generally, what happens is whenever we are conducting research, especially in my department, Kai Chikits also, generally whenever students are taking projects for their thesis or synopsis submission also, what happens is it's a generalized term. Why I want to emphasize on it, you people will understand that it will be like whether this particular medicine is useful on this disease. Let us think that Phalatrikadikvat and its action or efficacy in Prameha. Now, whenever we are designing the particular trial, what are the criteria for inclusion and exclusion? Rather than focusing on particular signs and symptoms mentioned in Ayurveda, we generally tend to write it as objective parameters like blood sugar levels, HbA1c, and all such things. See, whenever we are postulating all these things, it is okay because we require those objective parameters. But we need to understand that if our text or literature say that particular drug will be useful in particular type of prameha, maybe santarpanotha or apatarpanotha, we need to mention that as well. Because carrying out the research and finally concluding that this particular drug is useful only in santarpanotha prameha, but is not all that useful in apatarpanotha prameha, doesn't make sense when it is already mentioned in our text. So what is required is, parameter should be maximum Ayurvedic. Why it is so? Because we need to study it from Ayurvedic perspective. Suppose it is mentioned that Meheshu Santarpanam Eva Karya. Then we need to understand that wherever it is Vataja Prameha, especially Madhumeha, according to Ayurveda, then Santarpan treatment is given and that is useful. Okay, so such sort of research tools and such sort of research problems should be postulated, and then only Ayurvedic research can be done in a absolute proper way or genuine way. Why I'm saying so is because suppose we are postulating it this way, that woman given in Kushtha Vyadhi, right? Now all of us know that during Vata Upakram, it is said that Samshodhanam Mrudu, right? Vatasya Upakramaha Sneha Sweda Samshodhanam Mrudu. And we are carrying out Vaman and we are giving same medicine for a Kapha Prakriti Vyakti as well as Vata Prakriti Vyakti. According to me, it will create a problem while postulating the final conclusion. So all such things should be mentioned properly and should be mentioned in research methodology. Then only that research will be useful to potentiate Ayurvedic concepts. So in Ayurveda, what is required is EBM, that is evidence-based medicine. Ayurveda itself is a evidence-based medicine, and clinical trial regimens limit the use whenever they are postulated as per modern parameters only. If they are postulated from Ayurvedic as well as modern parameters, then it is absolutely okay. But if those are only modern parameters, then what will happen? They will limit the use of Prakriti, Dosha Anubandha, as well as Agni, Samavastha, Niramavastha, and other things. So if we don't consider Prakriti, otherwise the hypothesis or principle of treatment is Purusham Viksha. And we will be saying that Dusham, Desham, Valam, Kalam, Analam, Prakriti, Vayaha. All these things we are studying in our theory, but if we are not implementing them while carrying out the research, then that is of no use. So if we try to do it evidence based, though Ayurveda is evidence based medicine, and medicine based evidence, is difference between Ayurvedic medicine, Ayurvedic science and modern science. We will see that difference as well. So what we need to understand is, while designing a research, we should also take into consideration our own parameters, that is Ayurvedic parameters. Otherwise, it will be not fruitful as it has to be. In Anusandhan definition, what is mentioned, we know the definition of Anupan. Anusaha paschat va piyate yat iti Anupanam. So in Anusandhan also, to follow or to go along with. And what is the importance of scientific studies? It is always mentioned in our Samhita, that is Shastram Jyoti Prakarshartham Darshanam Buddhiratmanaha. So an intelligent person who is inquisitive also and who is sincere and genuinely working also, for that particular person, our science is going to enlighten his buddhi once again. These are synonyms of the Anusandhana. What are the qualities of research in Ayurveda? It is definitely important. The way we say that Chikitsa Chatushpad are very important while actually carrying out Chikitsa. Same way, qualities of researcher are also equally important when particular research is carried out. So, this particular researcher should have knowledge, Vitarka, that is critical approach or analytical mind should be there. Vijnana, so it should be insightful understanding about the methodology. Smriti, that is good memory should be there. Tatparata, perseverance as well as alertness should be there. Practical approach, intellect, and karma drushti abhyasa, that is practical experience and knowledge. The way I said that, unless and until we actually take incision, we don't understand what is the difference between the skin texture, what is the difference between the layers while we are cutting them during the surgery. Unless and until we do PV or PR, we don't understand. Unless and until we listen to the different murmurs, we will not understand. So karma abhyas is very much important. Need of research in field of Ayurveda. What is required? First important thing is days are gone when we can say that we have blind faith. That is, it is mentioned in the text, and that's why everyone has to follow it. So we will follow it, but other people will not be ready to follow it with only blind faith. So concepts and terminologies need to be confirmed, and then those should be utilized and standardized and utilized. So for better treatment modalities, there is need for research in Ayurveda. Same thing, Ayurvedic diagnosis should be pinpointed, and if we can design such diagnostic tools, it will be helpful to carry out research. Why it is essential? Because once we say that Vata Kapha Jwar, then Vata Kapha Jwar will have symptoms, and same symptoms or similar symptoms will be seen in Kapha Jwar also. This is particular what we can say problem while deciding about Sandhigata Vata Samavastha, that is Upastambhita Sandhigata Vat and Amavat. Then even students will be thinking that what is the difference when it is Sandhigata Vat and Samavastha or Aurajanya. Welcome Supriya madam. So Samavastha or Sama Sandhigata Vat as well as the Amavat. So there is a what we can say, not watertight compartment, but there is a delicate line between that, and so such diagnostic should diagnostic tools should be perfect. Then and then only research can be carried out genuinely. So difference between traditional medicine and modern medicine. What are the benefits and what are the shortcomings? Knowledge protection is in Ayurveda, it has open access. In modern medicine, it is patent protected. Nowadays, even Ayurvedic people are getting patents for their research work, and which is a welcome move. In formulation, traditional medicine, generally we add on it while consultation with the patient, whereas in modern medicine, the medication is predetermined. And once tested in clinical trials, it cannot be changed unless and until it is retested. For regulation, generally traditional medicine preparation is done by various people, and every time it doesn't go through all the standardization criteria. Whereas regulations for modern medicine are extremely tight, and bringing drugs to market now costs billions of dollars. So testing, generally formal testing every time is not done, but commercial purpose now it is made mandatory. Whereas in modern medicine, rigorous trials are done. In Ayurvedic medicine, while giving Ayurvedic medicine about dosage, all of us know that it is not only the per kg body weight dose, but we give the dosage or we alter the dosage of Ayurvedic medicine as per Prakriti of the patient and dosha dhikya in the patient, or the severity of the disease in the patient. Whereas in modern medicine, generally dosage will be calculated as per the body weight of the patient. What is bad news about Ayurvedic research? Ideally, I shouldn't be saying it in front of Supriya Madam especially, because she is into hardcore Ayurveda research since long. One study was carried out, and that particular study or survey was of 225 research articles, which were published in these 3 journals, which are reputed Ayurvedic journals. And what that study ultimately concluded is that particular research or research methodologies which were followed while carrying out those researches were not up to the mark. They neither fulfilled Ayurvedic perspective nor they stand true or perfect on the modern research tools as well. So what is basically there, that it is difficult to include comprehensive Ayurvedic individualized diagnostic and prognostic approach, mainly clinical in nature, to design a clinical study. So it is our duty to postulate such things which will be useful, that we can actually incorporate these things while carrying out the clinical study. So the outcome or the conclusion of this survey was that there was broad gap between the research methodologies, and most of the clinical studies, they remain inconclusive due to poorly defined correlation with disease process and lack of specific parameters. So now what is the way to success? If that was the situation till 2007, then what can we do as Ayurvedic people for the success story? So way to success can be, key factors for evidence-based Ayurvedic medicine will be good agricultural practices for natural material. So द्रव्य गुणाची जी औषधं मिळणार आहेत, वनस्पती ज्या मिळणार आहेत, those should be of good quality and cultivated in with the proper required atmosphere. So that is required, and after that what we can do is making monographs. Now even Rasashastra department knows it, that there are monographs of various medicines, so that standardization of the Ayurvedic formulation can be hastened. So good manufacturing practices should be followed, and after GMP it has to be GCP, that is good clinical practices should be followed, so that proper raw drug is available, standardized medicine is prepared, and standardized clinical trial is carried out. Then and then only we will justify whatever we are doing. So the last thing will be good laboratory and clinical practice for research. Now, how this can be achieved? Is there a way that only Ayurvedic perspective will help? Better to go ahead with collaborative research. Why it is so? Because the futuristic approach that is combined with Ayurveda, modern medicine, as well as biomedicine, through 3 main approaches will lead to the success. And that approach should be reformulation and contextualization of Ayurveda fundamentals, that is Siddhanta. सेकंड विल बी आयुर्वेद मॉडेल डेव्हलप करणं रिसर्चचं आणि ते एक्झिक्यूट करणं. अँड थर्ड थिंग विल बी लोकलायझेशन ऑफ आयुर्वेदा. Now PPPM and PCM, these are two things which are into practice. So PPPM is personalized and preventive medicine. So preventive aspect is taken into care rather than giving medicine after disease is into process. So we will see that research also, and you people will understand that. So personal centered medicine, person centered medicine, that is purusham purusham viksha. एखादा पेशंट ट्रीट करणं आणि डिसीज ट्रीट करणं. इन ॲलोपॅथी मेडिसिन्स विल बी लाईक से अँटीसायकोटिक्स और अँटासिड्स, बट इन आयुर्वेदा इट विल बी लाईक कामदुघा, सूतशेखर और प्रवाळपिष्टी और सारिवा और शतावरी is given to treat amla pitta in the particular patient. So person centered medication is what Ayurveda expects, and disease centered medicine is what is there in modern medicine. So what are the concepts? Those can be studied from Ayurvedic perspective. We have a concept like srotogamitva, right? So we say that whenever gokshur is consumed, it will mainly go to mutrava srotas. So this particular concept should be studied with a proper research design to emphasize this particular concept in Ayurveda. Another thing is jnana grahana prakriya, how one achieves knowledge. All of us know that in Ayurveda it is mentioned that atma manasaha sanyujyate, manaha indriyena, indriyaha arthena tato jnana. And we can always accept it this way. Suppose there is some shlok chanting or something, we may not pay attention. But if background playing is natu, 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 then probably that jnana will come immediately. Why? Because atma manasaha, manaha indriyena, and indriyaha arthena tato jnanam. Dhyana grahana prakriya requires this particular establishment of chain. So such things we need to prove with Ayurvedic research methodology. नानात्मज व्याधी प्रकृती, that is genotype and phenotype. What is genotype and phenotype? Generally we say that prakriti is inherent and that will be decided while the shukra shonita sayog only, right? And then we say that some factors like matruja, ahar and other things will affect it. While that's why we always emphasize on garbha sanskar. Now one study was carried, and where in Ayurgenomics. So in Ayurgenomics, what was the study? That genotype and phenotype. What is genotype? Genotype is basic DNA structure. I will go to that slide so that it will be easy for understanding. In this genotype remains same. All of us know that 23 pairs of chromosomes will be there in human being. That is what is proved with particular CYP2C19 gene was studied. And what are the genetic linkages in Vata, Pitta and Kapha Prakriti that was established by the research. So such sort of studies are essential. About Shat Kriya Kal also. All of us know that Shat Kriya Kal elaborates 6-stage progressive transition and balance from balance to unbalanced stage in Vyadhi Nirmiti and appropriate time of treatment. What we generally say, Chayo Vruddhi Swadhamneya. So what is required? Only Langhan may help. But in Prakopavastha, what is required? That probably we will have to give Deepana. In Sthana Samshayavastha, Deepan and Pachan will be required. In Vyakti and Bhedavastha, Pachan and Samshodhan will be required. So this particular Kriya Kal oriented, in which stage is the disease of the particular person and which medicine should be given, that can be done by stratifying people in various stages and then giving that sort of a medicine. It can be done in a generalized study. Now another thing is how we can use collaborative study. Generally we give Shashti Shalik Pindaswet for Mausagata Vat as well as muscular atrophy and Mausakshay also. So what can be done is From Ayurvedic perspective, we can see the results, and same way we can do electromyelography to actually see what is the difference in pre and post stages. Same way, reverse pharmacology, all of us are well aware of it, and ethnopharmacology and system biology should be studied. Prakriti we have just covered. Dosha and guna vitiation. Everyone is I think I'm exceeding the time. So within 10 minutes, we will complete the presentation. Dosha and guna vitiation. All these sutra are mentioned in our grantha or text. That is Ushnena Yukta Rukshadya Vayoho Kurvanti Sanchayam. How many of us have already seen it in patients? Because ultimate aim of research should be the benefit to the society, not only getting degree of MD or PhD or something. So what is required is we should be thinking about it and we should be implementing it. So once we see that, then only it can be, once we study it, then only we can implement it in patient. And if those are the criteria, that is Ushna and Ruksha and Vata Chaya Lakshana are seen, then Vyatyasa Chikitsa will help in that particular person. So if Vyatyasa Chikitsa has to be applied, then we have to thoroughly study all these sutra. Rogi Roga Pariksha, all of us know that these points and Ashtavida Pariksha, that is Nadi Malamutra Jivha, should be carried out from Ayurvedic perspective, not Nadi Pariksha dash 72 per minute. That is not Nadi Pariksha as per Ayurveda. One thing only I will explain within 2 minutes. There is typical Vedana Vishesh in Ayurveda. This particular concept of Vedana Vishesh. What is mentioned? That symptoms of Vata increase. All of us know it very well. Sramsa, Vyasa, Vyada, Swapa, Sada, Ruptoda, Vedanam. Right? Then this is typical and particular type of pain which person or patient will have while Vata vitiation. So in such a condition, only Vata Shaman will give result to the patient. But till now, I haven't seen any paper, that may be my mistake, which has categorically mentioned that these particular symptoms are seen in these conditions, and that's why only Vata Shaman is done and patient is getting relief. So such sort of research is required. It is not only Vata vitiation, but further our Acharya and texts have elaborated that Vrana in Shalya Tantra also and Vata vitiation will lead to specific type of Vedana. So even there also Vata Shamana treatments or Vranopakram can be done and treatment will be complete. Now, as per the Dhatu Sanshraya of Vata, there will be specific type of pain. So treating Vata in that particular Dhatu will require specific treatment. I hope I am clear with everyone. So it is Vata vitiation, so specific Vedana. It is Vata vitiation in specific Dhatu, so specific type of pain. And so Dhatu Bala increase in Dhatu Bala will lead to Upashaya in that Vedana. Another important thing, which type of Vata is vitiated and accordingly which type of Vedana can be seen in patient, and such sort of study or survey should be done so that Chikitsa of Pranavayu can be done for particular symptom. So development of tools, I will not go in details because time is short, but developing tool, that is especially diagnostic tool, is very much important. One study was done in our department only, wherein we have treated patients of Jirna Amavata, and what sort of chikitsa was given to those patients, Laghu and Santarpan, because in Jirna Jwara also dosha are less comparatively to Navajwara, but Dhatu Bala is also less because of prolonged Jwara. Same condition in Jirna Amavata, quantity of Am is little less compared to Nava Amavata, but Dhatu Dushti is more, and so Udarka, like joint deformity and other things are seen because of Vata vitiation. So this particular treatment by the name Amvat Gajasiha Modak was given to patient, and we got very good results with that particular combination, and still we are giving that medicine to patient with Jirna Amavat, where Am is comparatively less, but Vat is more because of long-standing disease and because of long-standing Dhatukshay. What does clinical research achieve? Let us not waste time in this theoretical part. Actually, I wanted to emphasize on these particular things, that is component of Panchavayava Vakya, that is Pratijna, Hetu, Udaharan, Upanay and Nigamana. But I have already received this particular cheat with a magical message of finishing in 5 minutes. So I will not go in details. I am really sorry for that. Technical terms about Pramana, Prameya, then Samyasa, Prayojana, Drishtartha and Siddhanta. All these are means Tantra Yukti implemented, Panchavaya Vakya implemented and Dashavidha Pariksha implemented in clinical research, and how we can correlate Ayurvedic concepts with the modern concept. So Jalpa and Vitanda, if we see second last one, what is mentioned is biased result or manipulating the discussion to reach in the desired result. So we can compare these things, and such terminologies can be mentioned in our research so that to replace the modern terminology. Karana, Karana, Karya Yoni, Karya and Karya Phala. What is Karya Phala? In research implications, it will be effect of intervention interpreted on a broader perspective based on the aim of the study. I can understand if I would have been in audience, probably this would have been sort of Ama Nirmiti Kara, going so fast, but I'm really sorry for that. Technical terms. Evidence-based, this would be the last slide. Evidence-based medicine and medicine-based evidence. In modern medicine, unknown medicine is validated by modern scientific techniques and multidisciplinary efforts, resulting in the formulation of certain clinical evidences. Whereas in Ayurvedic medicine, what we generally do is we prove the efficacy of the medicine. So that is the basic difference. This is one of the examples of a patent which is gained for a Ayurvedic device, that is Kshar Sutra cannula cum applicator, wherein the sterilization of Kshar Sutra as well as using Kshar Sutra with Kshara Sutra probe, everything is been nullified. This Kshar Sutra can be stored in this cannula and it can be used as a Kshar Sutra applicator also, and so it will be what we can say, SOPs will be followed, that Kshar Sutra will be applied and there will be less pain to the patient. So this is possible if students put their efforts into research methodology properly and develop such sort of thing. Thank you so much, and let's join for hands-on training session, which will be the next session. Thank you so much.
Anaya madam, in the beginning you said you are not the expert from research, but I am surely say that it was a very fabulous and informative lecture. You rocked the stage. What you say, audience? You lights on research methodology through Ayurvedic aspect with an elaborative way. May I request our chairperson and co-chairperson to conclude the session, please. Mic, I have mic then.
The session conducted by Dr. Anaya Patrikar, Research Methodology in Ayurveda Perspective. जो सुना था वही पाया. 40 to 45 lectures needed for the research, and she concluded it in one session. How's that? So good. And we are also proud, feeling moment for us that रोग निदान related experts, judges, चिकित्सा related person, that is the good. And several things uses Shatkriya ka, Nidan, Dashvid, Astavid. These are nothing but rog nidan related basic fundamental points. She conclude and cover so many topics, so several topics, and with her own experience regarding her Kai Chikitsa OPD, which I get acknowledged right now. When Madam explained about the research and what is research, the simple funda is what is research. Research is a question. Research is a research gap, and you need to fill up to fulfill for the nurturing of your own science. And the most important aim for the research gap, research question is it should be fruitful to the society. And if you keep these 2 points in your mind, you will definitely reach your goal. Because if you see in each colleges, there are many PG colleges, PhD colleges. They are doing several research projects. Thousands of research happened in a year, each year in India. And what is the fruitfulness and how much it is applied in Ayurveda faculties? It is a questionable mark. So how much it is fruitful and how much it is nurturing your own subject, that is the important part I want to mention. Then when you are going to for a research project, it should be associated with prevalent rate and sample size. So what is prevalence rate? It is never a standard protocol. The prevalence rate in fungal infection in Maharashtra, Bhusawal, it is totally dry. Its prevalence will be very less. But in Mumbai, which is a humid, its fungal related study and its prevalence rate and sample size will be more. So the regional, geographical, and atmospherical, these factors can be changes, not unique. And these factors, even in what city you are, what is the climate, and what is your hospital related sample size per animal, that is the prevalence rate, and that is the study. So the diagnostic study, Madam explained, it will be interventional and non-interventional. So non-interventional, you are nothing doing, but it is just an observational study. And in observational study, you are not doing anything. And still, I request you that you should have to register your own thesis in CTRI with proper institute ethical committee and all the documents, and then what we say clinical trial registry, you should have to register. So your topic will be unique, patented, and no one will copy. And thesis, what Madam explained, there is a 2 chances. It will be null hypothesis or alternate hypothesis. Doesn't matter that you are accepting null thesis. That doesn't mean that your thesis is invalid. No, it is not. That you are showing this is not the correct path and this is not a fruitful path. Don't go in this path. So this is also kind of direction to which direction you are going to achieve your goal. So null hypothesis, and if there is an alternated hypothesis acceptance, this is the wonderful thing. Positive results definitely glorify your result, and sometimes we change your own life in lab. So the quality of research, what Madam say, after the diagnosis, modern say, if you are a diagnosis typhoid, it is confirmed that 10 milligrams ciprofloxacin per body weight is universal. But why there is a what Madam said, she said Purusho Purusham Diksham. What is that? That is nothing. It is related to Ashtavidha Pariksha, Dashvidha Pariksha. You know, Dashvidha Pariksha is a assessment of Rugnapat, Prakriti, Vikriti, Sahar, Sahan, and all the things. Regarding that, you changes the treatment protocol. You never give a fever person who is a Vata Prakriti, you never give Uduchi because Uduchi is a Tikta Rasatmak and Tikta Ras will increase the Vat and that Vat doesn't, that Ras that doesn't decrease the Jwar and actually uh, um, not in the way for the better treatment. While the Kapaj Prakriti person and you want to reduce his fever, definitely Tribhuvan is a good option for that Kapha Prakriti. So this is all because of the Shvita Pariksha and that's why we are not confirmed regarding Prakriti, Vikurti, Sar, Sahanam, Bal, Kal, Desh and all these things. And what madam say, bad news. Why there is a bad news? If you listen it carefully, what happened? It is a bitter truth, but I have to mention it. Allied subject expert never nurture the concerned subject because he always pick up with his mindset in the same what he achieved in his post graduation. His thinking and his mindset is same. So Kai Chikitsa person never think in the way of Rog Nidan. He always think in the way of Chikitsa. And what he labeled there, क्षय में चला जा और उसमें देख ले मेडिसिन काम कर रहा है तो डायग्नोसिस ये है मेडिसिन काम नहीं कर रहा है अनुक्षेप. This is not the way because the Rog Nidan is a vast subject just like Sparshanindriya and it touches each and every part. So this is all from my side and I congratulate to madam and thank you one and all.
First, I congratulate Anaya madam who has delivered a detailed lecture on research methodology and Ayurvedic perspective. She has covered all from that definition to whatever the methods which is applied to do research. I think here are many students of undergraduate, postgraduates, and PhD scholars. So we should do research only evidence-based. We have to prove whatever which in our text told. And first of all, we should satisfy, that is, any researcher should satisfy with his own work. And then society should satisfy with whatever the work he has performed. Thank you, madam.
Thank you, sir. Now, may I request Organizing Secretary Dr. A.S. Dudwal, sir, felicitate our speaker, Dr. Anaya Patrikar, madam. Thank you, sir. Thank you, madam. Now, may I request Dr. Mangesh Deshpande, sir, to felicitate our chairperson, Dr. Sandeep Dahinekar, sir, and Dr. Santosh Gidbide, sir. Thank you, sir. Thank you so much, sir. Friends, our second session is very interesting session because it's a hands-on training on various types of research methodology. To elaborate this topic, we have two stalwarts in this field, Dr. Supriya Bhalerao Madam, scientist and HOD, Metabolic Research Lab, Bharati Vidyapeeth, and Dr. Asmita Velle Madam, Professor HOD. Zoom on आहे ना ते चालू आहे ना आपला डिपार्टमेंट Professor HOD Department of Rasabheshya Bharati Vidyapeeth. I like to request Dr. Pooja Shetty, Assistant Professor Kriya Department, Ivy College Science, to give brief introduction. May I please request the speakers to come on the stage. Dr. Supriya Bhalerao, MD, PhD, MA, PG Diploma in Clinical Research and PG Diploma in Bioethics. Currently working as a scientist, head, Metabolic Research Lab, Interactive Research School of Health Affairs, IRSHA, Bharati Vidyapeeth, Deemed University, Pune. Completed 2 government-funded, 7 pharma-sponsored, and 15 academic projects as principal investigator. Her list of achievements include member, pre-SAC of ICMR NITM Belgavi, member, expert committee for products approval, FSSAI, Government of Health and Family Welfare, member, Data Safety Monitoring Board on monitoring of clinical trials and population-based prophylactic studies of Ayush interventions related to COVID-19. Associate Editor, Journal of Ayurveda and Integrative Medicine. Invited for more than 350 lectures on research methodology, statistics, ethics, scientific writings, and pharmacovigilance as a resource person in guest lectures, workshops, seminars, and conferences across the country. Publications of more than 50 in national and international journals. With this, I would like to also introduce Dr. Asmita Velle Madam.
Dr. Asmita Bede is the professor and head of department of Professor Kalpana, Ayurveda Pharmacology and quality year tenure of Dean of Harmony as chair professor and has been awarded honorary professorship at types. She has been the principal investigator of PSC lecturers as a resource person in several interdisciplinary workshops and conferences on public platforms. She has guided 50 master's students, 2 PhD students, and many more. She is often invited to be a PhD resident for RMIT University, Melbourne, Australia. She has published over 50 research papers, articles, chapters, and authored a book on research methodology for Ayurveda. She is a reviewer of some index journals from Elsevier, Scopus, and PubMed databases. She has been the associate editor of Journal of Natural Health Product Research, NHPRS Canada. Her areas of special interest are asthma, cancer, neuropsychology, and nutrition. Apart from her expertise in Ayurveda drug development, she is a member of Pharmacopoeia Commission of Indian Medicine and Homeopathy. Consistent with her family legacy of Vaidya tradition from Goa, Dr. Asmita has earned her BAMS and MBBS from the University of Pune. She has completed GCP training by CDS code and ECIRB training by DIDS supported by NH and completed certificate courses in designs of clinical trials, review training, and book writing. She was the Ayurveda expert and co-rapporteur for historic working group meeting for development of WHO benchmark documents on Panchkarma, Ayurveda practice, and training. She is an active member of many organizations. She has traveled to Europe, USA, Mexico, Africa, Nordic countries, Middle East, UK, etc. on professional assignments. She has also a private clinic in Pune. The long list of achievements of both the speakers, I would like to hand over the mic.
Thank you, Pooja. A big round of applause to our guest speakers, Dr. Dhalera Madam and Dr. Vele Madam. For this session, Chairperson Dr. Mukund Magresar, Professor, Kai Chikitsa Department, R.A. Poddar Medical College, Burli. Dr. Magresar, and the co-chairperson is respected Dr. Sujata Jagtap Madam, HOD, Prasuti Tantra Serum Department, Ayurveda College Science. Give big rounds of applause. I request Dr. Bhakti Sawant to kindly give introduction of both chairperson and co-chairperson.
A very good morning to all. The chairperson and co-chairperson for today's event are chairperson Vaidya Mukund Magresar, MD Kai Chikitsa. Sir has done from MD Kai Chikitsa from Dr. B.O. Marathwada Vidyapith, Chhatrapati Sambhaji Nagar. Sir has a total teaching experience of 34 long years. Started his teaching career in Maharashtra at Dharashil and currently he is teaching at R.A. Poddar Ayurveda College, Burli, Mumbai. He is one of the renowned and successful Kai Chikitsa practitioners. Co-chair for today's session, Vaidya Sujata Shrikant Jagta, MD Sri Prasuti Tantra from R.A. Poddar Ayurveda College, Burli, Mumbai. Now she is head of department and associate professor in Sri and Prasuti Tantra department at Ayurveda Prasarak Mandal, Ayurveda Mahavidyalaya, Science, Mumbai. Her academic experience is almost 21 years. She has done 4 research projects as co-investigator. Now she has been involved in 2 research projects as a principal investigator. KHS MRC has been involved in various government programs like menstrual hygiene awareness, cancer prevention and detection, and nutrition policies. A huge round of applause for our chairperson and co-chairperson.
Thank you, Dr. Bhakti. A warm welcome to the dignitaries on the dais. Magaraj sir, welcome. Now, I hand over the mic to Dr. Bhalera Madam and Asmita Vele Madam.
त्यांच्या हातात मॅडमच्या हातात माईक नमस्कार सगळ्यांना मराठी हिंदी दोन्ही समजते इंग्लिश तर आहेच आपली कॉमन लँग्वेज पण नमस्कार सायन कॉलेजमध्ये आज आम्हाला इथे बोलवलं याबद्दल आपले प्राचार्य आपली सगळी समिती आणि आमच्याशी थोडं कोऑर्डिनेट करणारे डॉक्टर देशपांडे या सगळ्यांचं मी अस्मिता वेले माझ्या बरोबर सुप्रिया भालेराव आमच्या दोघींच्या वतीने सगळ्यात पहिल्यांदा आभार मानते आजचा आपल्या okay so when we started discussing about this one day program we had asked for a hands-on workshop and the title is also given in the same way that this is a hands-on kind of workshop. What is hands-on? So I can see students behind. आपण lights लावू शकतो का जरा? For hands-on workshop, what we need to do is we need to understand what you expect from us. Because you all are postgraduate students and PhD students. Those who are doing PhD, they already have completed their MD they have completed their MD dissertation. They have submitted the MD dissertation and then written papers and acquired their degree. Similarly, for PhD, it's purely by research. So we both were discussing since we came here that came to know that this is in hybrid mode. And we started that okay, then we have to shift the format. It can be a little bit of hands-on and then probably we will switch over to lectures. Let's see how it goes. Right, Dr. Supriya? So should we, as we plan, should we ask them about their topics? Yeah. So MD students, raise your hands, please. MD students. Okay. 1, 2, 3, 4, 5, 6. Can you come a little bit ahead? I can very well imagine that for you attending the workshop is important, it is of your college, but for us it is very, very important that we should give something to you which you will which will remain with you for long. And that's our responsibility. So PhD students, can you raise your hands? 2, 3, 4. But most of them are MD students. Okay. Can you tell us your topics one by one? First student. First MD student sitting here, the girl with the specs. Yes, stand up please. Okay. Let's start. So let's start. There is no topic yet. Anybody who has started topic? Anybody who has started topic? All these are new entrants. New entrants. Then I will.
Madam, I am also.
Wonderful. So if you are a PhD student, can you tell me your topic?
So everybody has to participate. If you don't participate, conference, very low, again, come back. If you really want to have a feel of workshop, all have to participate. But we like your parents, that is not workshop. Workshop is Karyashala. So everybody has to do some Karya, right? So we expect you to speak something, ask something, understand. Face your difficulties, that we cannot do because they are more about it. We expect this kind of, and each week stoppers at midnight points are working. Please make you have a workshop as organized.
Okay. Are you with us?
Yes.
I cannot hear.
Yes.
Good. So, most of them are newly entered students. She said that she is a PhD student. Okay. So, can you tell us your topic?
Hello, I am a PhD student and my topic is randomized comparative clinical study of Yashtimadutay, Pichudharan and Apamadachal Pratisaran in cervical erosion, that is Garbhashay Grivavrata Prana, with standard criteria of evaluation. This is my topic.
Wonderful. Wonderful. So, after listening to her topic, we immediately come to know that there is a clinical study. There is a comparison. This clinical study belongs to, or the discipline in which she is working is obstetrics and gynecology, especially cervical erosion. That means she will be working in gynecology, and there are two drugs, and she will be comparing the outcomes. Which drug is better out of the two, right? So, based on the title, you can immediately figure out what the study is about. That's very important. So, first thing about research is whenever you select an area, whenever you select a topic, then you should be able to put it in manner in the title form, which gives you the idea about what we are doing. And that's what she has done. Now, this being a clinical trial, there is a particular protocol. Any other PhD student here? I saw raised hands. 4 hands were raised here. Can you tell the topic at least the area? Huh?
Shivan,
So, this topic talks about hemiplegia, paraplegia. Hemiplegia. So, hemiplegia, and he will be working in a type of basti and shirobasti and Mahakarmido. So, internal as well as external treatment. But he is not doing any comparison. He will be studying on only one group. Okay. Okay. So the Panchakarma procedures is similar. He also working as a comparative study, clinical trial. But these are common and two drugs are different. So he is going to basically map the difference one of the drug is going to make, whether it will be equally effective or one drug will be better than the other. So these trials are clinical trials. In today's session, how to prepare a clinical trial protocol and what all components are there, that Priya Madam is going to talk with you after the feedback. Any of you is studying on drug development, drug standardization? Is it there? Any topic? No.
There are few students, I think I can see Dr. Shivani, Dr. Kanchan. Please share your topic so that it will be more interactive and informative session.
Topic is a comparative study of physicochemistry and in vitro antimicrobial activity of four different formulation of Nirmani inverter, namely Nirmani oil. She has taken one basic drug and then made different formulations of that basic drug, and she will be comparing using in vitro as well as in vivo techniques. So basically, before that, we will be doing characterization and standardization, part of standardization. Right? Another area. So when we say generally in Ayurvedic field, we understand or we look at research as drug research, clinical research, literary research, which is not there in any of the medicines except Ayurveda. So I know lots of medicines, but except Ayurveda, even in Ayurveda, Siddha, these two streams, we go ahead with literary research because we have a lot of wealth of literature. And therefore, we go ahead with that searching, scanning that literature to find out whether from that wealth we can come up with some solution to modern day problem. So this literary research is not the part of any current modern branch. In Ayurveda, sorry, I saw you sitting there, but I will come to this point. In modern clinical practice or in modern research, when it comes to health, is generally about behaviors. One very important research area, which is again conventional or traditionally, I would say that drug research is literary research and fundamental research. Achara Dheeraj Sharma ji, your madam already has said that Dheeraj Sharma of research, Anusandhan. So he has said about it that fundamentals, basic principles, and there has to be a research of basic principles. And this concept is picked up by the stalwarts, like seniors like Dr. Ashok Vaidya, Professor Sanjay, and Supriya Madam also was part of the whole consortium, where these people have converted this concept into Ayurveda biology concept. And they have created a platform where you can write your submit a research proposal to understand the biological aspect of Ayurveda that goes into fundamentals. So beginning with the types of research, as we look at it, it changes. And as we look at it, if we are going towards qualitative aspects, social, then we go towards qualitative aspects. But if we want to measure Ashtanjali, there is Anjali Praman. So can there be a common Anjali or towards measurement, and it becomes part of, not exactly whenever we use with the qualitative or quantitative methodology is very I think in all these types of research, what is most important is research. And again, I want to highlight that may it be experimental research, which is conducted in lab. We all know physiology, we all have learned various physiological tests. When you are sitting in your 5 sheets of PD, you also talk about ELISA, you also talk about various markers, especially everybody knows many markers and their taste, and we also know IMPs and all. So in film, we all need to understand its taste, their results, how to read the test, how to analyze Peter Moller is the name of the scientist. So if you read that whole newspaper writer, that is nothing of literary research. So literary research is writing criticism or writing a complete overview about yoga Ratnam, overview about Charak Samhita. That becomes literary research. But literature search is different than this. Literature search is about your topic. Whatever topic you have selected, now these two people have selected, one is working with Parshana, the other person is working surviving some standardization, characterization of one particular drug and its four different formulations, and the other may get chance to talk. She has been working on something like this. So when you are working on different, take the gist of your particular area is done through literature search. Am I clear? Literary research and literature search are two different things. Literary research deals with a content which is already there, and you critically analyze that content to find out the meanings, to find out what I think of all of that. And then you talk, this is good, this is not good, this is not done, this is well done, this is how it is. So that is literary research. And literature search, I will take you through the presentation. Important point is the strength and limitations, your personal as well as at your institute. Is this moving? These are the key points of today's lecture. What is literature search? What are the objectives of literature search? Where to search? What is the basic methodology? Search approaches. You will learn three new terms here: broad brush, incremental, and integrated. How to remain focused. Taking notes. I think nowadays not a single person takes notes. Everybody, just takes a photograph or downloads. So writing, I think after 20 years, we won't be able to write because they are always 10 or 20 years ahead of us. They all have come back to use of pen and paper. In Europe, if you find every person who is working in this field, it's carrying a small notebook, small, literally this size notebook and pen in the purse, even if that size purse. And they write during the meeting, or if they want to. They don't use mobile, they don't do tick, 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 tick. And that is a change that has occurred in mostly after COVID. So finding out research process in research-based literature, critical analysis of the literature, and Ayurveda. I have already talked about literary research, so I'm going to skip this slide. Literature search, what does it do? It forms a background or platform for new hypotheses. I'm sharing an example with you here. Don't read the slide. Listen to my example. When we started, in our institute, there is institutional innovation cell, because we believe that all our students, they come up with different ideas. The undergraduate student, the postgraduate student, and mostly they feel shy, so they don't, open up about those ideas, and a lot of innovation or the idea goes waste. Ministry of Education has floated this concept of Make in India. Along with that, innovation is the key to success. And in our country of 1.42 millions, yesterday we have crossed that number, and we are top at number 1 for the population. We have crossed China. So how many Nobels we have got till date? Only 2. So based on, to address this issue, that why innovations are not generated in our country, this innovation cell has been floated at ministry level, and Dr. Abhay Jere from Pune, he is the head of that. He is heading the whole concept unit from Delhi. So he has given this idea that, okay, in your college, if there are different ideas, they should come out. The first day when we started this exercise, students, second year BAMS, third year BAMS, stood up in the class and said, "Ma'am, I have an idea. We have learned that little girl, she was, so lovely and so innocently she was saying, ma'am, we are learning Nadi. And I cannot, really understand how to read the pulse using the 3 fingers and then doing all this vata, then this is pitta, then pran, apan, saman, vyan. It's very difficult. So can we come up with some, app? That was her question. Wonderful idea. Another student came up that, yes, we read a lot of things about different herbs, but we do not know whether they are available in our vicinity, which is the real species, what is its cost, whether this is, accessible, is it extinct species. So we need to have another app for the plants which are there in our syllabus, at least 120 minimum, and I want to develop that. Third student stood up, he said that, okay, we all talk about health and nutrition, but we have not come up with any substitute for popcorns. We should. And actually that's what is needed. So when these ideas popped up, what we did as their mentors, we told them to go back and do some literature search using internet, writing their ideas, giving some keywords. And then on day 3, everybody came back. The first student said, ma'am, there is already we read that he they are coming up, and that can be so my idea, this is what so we check the body of the patient, and that you can learn as a student. So there is still a possibility. So you can develop some different algorithm by which, using that, I can teach, using all these techniques to use. Students started working. The other student came up, there are lots of plants. So very important, very important. where you completion about any to withdraw, one other will take forward, and the third one, the popcorn just to make Nidra is immunomodulator. It is stress buster. So if you can avail a good night's sleep, whenever you collate the whole data, you can put an objective to the data and you can write a wonderful review article. Where to search? This is a very traditional thing. These journals are, journals are copied. Papers are this, that. I don't know how we function. They tell you about important areas. I think you are vice principal. They both said that problem in the society, and when you do research, you have to address a problem in the society. That problem, and when you work on that problem, you come and then your science gets along with that, you also get famous. You are getting patients based on your expertise. Or if you are in academics, you start getting students to work with you. The PG admissions happen. So all this is with the understanding that what type of research, what type of problem is there in the society, and experts are able to make you in the society. 97. So total one intervention where clinical trial registry. So that means the experts That is where the experts come in picture. Other than that, there are libraries, there are preserves, but everybody has smartphone. Can you open your Google Play? I would ask you to download 2 apps. Researcher. Somebody found? Got it? Wonderful. You already have. Very nice. Another app is so here you can see index journals and databases. This is the most important and prominent tool that we use today. And now this tool is on your handset. So you can just play with that app a little bit, just like you play with any app, and you will understand how to use it. Second app is PubMed Connect. PubMed, P-U-B, Publication Medicine. Pub is for publication, Med is for medicine. PubMed Connect, C-O-N-N-E-C-T. That's another app. It is on a white background and it gives you a dot and line. I'm unable to see, but yes, that could be the one. Yeah. So PubMed Connect. Download both the apps and they will bring indexed research papers from indexed journals, the journals which have high impact factor, to your mobile phone. And that's the most important aspect of literature search. If you have these 2 tools, the third app is Mendeley, M-E-N-D-E-L-E-Y. You know this? Mendeley, researcher app? Yes, I'm happy that you all know this. So this is your personal library on your mobile phone. So whichever area you want to study, if you type your words like cervical erosion using the Boolean markers and Ayurveda, herb, you will get research papers which are published in index journals, only those. Again, I want to clarify one thing for the young researchers here. We go to Google Scholar. Google is our university, Google Library, Google University. We type on Google Scholar anything. Suppose I want to work on Yashti Madhu. So I just type Yashti Madhu Ghruta and I find the hits. On the right hand side, you will see the number 30,000 something. In that, on those hits, what you find? You will find Yashti Madhu Ghruta selling companies, prices, then the companies who have prepared marketing literature. What is Yashti Madhu Ghruta? What are ingredients? What is its amount? What should be done? How it is to be taken, all that. Then you will find some of the some translations of Sanskrit shlokas. You will find some research papers which have really compiled all the information of Yashti Madhu from all Nigandhus with a nice English text. It is merely translations. And then you might come across 1 or 2 papers from ncib.nlm, National Library of Medicine, which is connected to PubMed. And there you will find a wonderful research paper which gives precise objective, correct methodology, results, analysis, and conclusion. So this is the difference between searching from Google Scholar to PubMed. We belong to a science. We belong here to postgraduate sections, and what we want to do is real science. So when we do some real science and we translate it for common people, then the information leaflet in a pack is required, but not for science. So do not mix between the two and use good papers for your research. I like this picture because I still believe in reading, not only online, though I use everything online. I really like the libraries to go sit quietly, focus yourself. It's kind of a meditation. So keep trying these also. I'm going to skip these slides because these talk about how to search and what needs to be done. There are various types of literature. When we start literature search, these are authentic sources, literature having ISBN number. Now, I have grown up in a traditional Vaidya study system. I was studying with Vaidya Kollatkar sir and later on with Vaidya Vilas Nanal sir. We were exposed to different senior Vaidyas, Gangadhar Shastri Gune or Vedimadhu Shastri Joshi ji or Atmaram Datar. I was fortunate to work with Bagewadi Shastri also. So I remember Bagewadi Shastri's book, Maji Chikitsa. Then there is another wonderful book which is written by Ganesh Shastri. There, you all know, 5 volumes. You all might have studied those. So, Fadke Shastri's book, because these books doesn't have ISBN numbers. Should we use them? So, whenever you are working for your research, you should use everything, but remember the classification. Because these books are not in ISBN system, they are considered as grey literature coming from personal accounts of Vaidyas, which should be taken into account. And based on that, you can write a paragraph in your literature that Vaidyas have done so far on this concept. After Samhitas, these are the practical real-life experiences which should be collated. Remember, that is a grey literature. The literature which comes with ISBN numbers, that becomes authentic literature which can be quoted or cited. I am sure you all must be doing citations. What is a citation and what is bibliography? So that puts this literature, giving it a some new instrument, some new idea, some new treatment for a known disease. And there is a possibility that you can patent it, but you should be sure whether it has been already patented or not. So check patent databases for this is not already worked on. You are how to search. How to search. I was writing an article on there was a question write about turmeric Indian term paper, and that habit is still here. So when I today wanted to take your workshop, we first discussed that okay, we will ask them what are your paper, and then we can group you
Thank you very much, madam. It was very informative session. Friends, we will take 10 minutes short break. We will proceed further with inaugural function within 10 minutes. Please stay with us.
येऊ सर सर येऊ सर आज लेट झालेलं मला दिलं झाली असेल चालेल चालेल
नाही काय आपल्याला ती 31 मार्च पर्यंत बनवते तसं करावं लागेल का असं मी विचारते. म्हणजे त्यांचं डेजिग्नेशन ते आहे तसं प्रॉब्लेम ठीक आहे मग ती करून आणि मोबाईल नंबर हे बोलतात की मोबाईल नंबर दाखवायचा नका टाकू ते डावले कोणाचं टाकायचं तिचा मोबाईल नंबर किंवा हा तेच
सर बोलले की देऊन मलाच दाखवा नंतर करेल सर साईन नाही केली सर मी नंतर करतो तुमच्याकडे द्याल येते तिकडे होतं ना. तिथे. खूपच खराब झालंय ते. एकदा एकदा हे झाडून घ्या ना. बघा कचरा. आणि इथं बघा कसं झालं. Thank you. मला ड्रेसचा कलर फारच आवडला.
within the workshop आपण बघतो त्यावेळेस विद्यार्थ्यांना जे अध्यापक